Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and I'll be your host today. We're here with our two guests. We have Dr. Jeffrey Lupo, chiropractor out of Roseville.
Hello.
Glad to have you. And we have Kristine Bonds, who is the Director of Appropriations for Opioid Awareness for the state of Michigan.
Hi.
Welcome.
Thank you.
So let's just kind of begin. Let's talk a little bit about, people are starting to hear in the media and in the news that we have somewhat of a crisis or an epidemic with prescriptions of opioids.
Mm-hmm.
So let's just kind of get a little background on, when that started, how that started, and what's happening here in the state of Michigan, but more in the U.S. in general as well.
Yeah, sure. Happy to talk about that. And quite frankly, let me take a moment to share how this journey began for me. About 5 years ago, I lost my stepson to an opioid-related death. And this past year, I started looking at the numbers across the board and realized that there were a lot of folks dying from opioid-related deaths in our country and in every state, every county, every community, and really was concerned with the lack of awareness relative to this reality.
Let's talk about some of the numbers with it
Yeah.
too, because the numbers to me are just,
Astounding.
It's extraordinary, it's astounding. It's
Yeah.
very surprising to the general population when they hear these numbers that
Yep.
how many people are affected by this.
So in 2017, 72,000 people died from opioid-related deaths compared to 40,000 deaths related to car accidents and 12,000 deaths related to gun violence.
So let's say that again, 72,000 people died from opioid-related deaths compared to only 40,000 for car accidents. So almost double the people died from opioid-related deaths than car accidents.
And put that in perspective, the whole war of Vietnam was 58,000.
Wow.
Yeah. Yep.
So last year alone, more people died from opioid-related deaths.
Yes.
And what does that
United
include when we say
States.
opioid-related deaths?
So, prescription pills, the synthetic drugs like fentanyl, and the reason why this is such a scary problem is that it's affecting all ages, all demographics, and certainly every family has been affected by it. It's almost impossible not to know someone that hasn't been affected by it. We have to think about the solution. And the good news is that it's not like we have to reinvent the wheel here. It's not like we're looking at a medical condition that requires a ton of money and a ton of research. We have enough research now to know that this is, addiction is an illness, and there are ways to address the problem and save lives. And truly, I think the metric is if we start seeing the numbers go down, then our plan of action, the solution is working.
Let's talk about how maybe the problem started in the first place. When was there a significant increase in prescription of opioids and the usage of opioids? And from what I see, a lot of it started when the metric used in hospital systems, they started using pain as a metric, as a vital sign. Instead of just the respiration, blood pressure, all the usual vital signs, they added into their metric system, which makes sense that they would do that because they want their patients to have good customer satisfaction and feel good, but they added pain as a metric. So at that point, it became very easy for doctors who want to help their patients, want to fulfill the metrics, want to make sure everything was right, to keep their patients out of pain. So what do is they prescribe opioids for pain.
It'll knock their pain out.
It'll knock their pain out. And so hospital satisfaction rates and hospital metrics went up. They did good. They got their patients out of pain. They were rated better that way. But no one knew what the long-term effects
When did that
would
start?
be.
Was that about
I think it was in
2000?
Actually, I think it was in the 90s. I mean, if we
90s?
look at the history of the opioids and so forth, we can really start to see something change in the 90s, and that was when we were told, America was told, that these were safe drugs to use. The doctors were told that. And of course, there wasn't enough research to say otherwise, right? Mm-hmm. And so doctors did start prescribing these painkillers, and it started to build from there. And I think what's very scary is that it's different than other addictions, because truly you can take it once and die from it. You know, it's not
Just
like
like that,
it's
huh?
not like a
One time.
progressive addiction. It can happen in one time. And for younger adults, the two main causes are oral surgery and sports injuries. And so they're, you know, coming home with a bottle of pills, and then once they run out of the pills, they are prone to seek, you know, something to make them feel that good again, and they go to the streets, and they have a really bad experience with heroin and or fentanyl, and that's how I believe it's really escalated.
So it starts with the prescription, and then it goes to whether it's the same opioid that they got that wasn't prescribed to them, or that was past the prescription, or heroin, street
Something
drugs,
similar.
fentanyl that they
Yeah.
got somewhere
So
else.
someone can get their wisdom teeth taken out,
Yes, yes,
and then they get that, and then they're just starting the downward spiral.
yes. I mean, how many of your patients come in for sports injuries?
All the time,
You hear this all
every
the time.
day.
And so, you know, you're part of the solution. You know, there's an alternative way to address pain as well as chronic pain. You know, if we can start, again, I think it requires, you know, Marshall Plan. It's prevention, it's awareness, it's education. And go ahead.
And we see a lot of our regular patients that come in our office. Maybe it started with a dad who hunches over a desk all day and he has a stiff neck, or a mom who had some pain from pregnancy. But now they know what our offices can provide. When their children have a sports injury, they come to us first.
Exactly.
They go to orthopedic surgeons that we recommend. We have orthopedic surgeons come into our office to see patients. And so instead of going right through the ER and automatically getting a prescription for opioids, they get, you know, our expertise in diagnostics and case management to make sure they're getting the right treatment and the right course of action. So we even have a lot of really great natural technology modalities that we use. Both in Dr. Lupo's office and mine, we use low-level laser, we use kinesiotaping, we use cold compression therapy, we use some different things that are
Magnetic therapy.
magnetic therapy, yeah. That's really cool stuff, pulsed electromagnetic field. And so some of these can be used in acute settings to help to decrease pain right away and limit the use of medications in the beginning, or the need for prescriptions.
And one of the main things you're talking about when people get injured is that they go to the doctor, or they go to the ER or the urgent care, and they look at them. They take a look and they say, well, maybe sometimes they need x-rays, or sometimes people get an MRI. And what they're looking for is there some anatomical cause to this problem? And for the most part, they rule that out. They don't have a fracture, they don't have a tumor, there's no infection. They rule this part out, and then it kind of stops about there. Nobody actually gets to the bottom of diagnosing the condition, because what's ruled out is there's something mechanical going on. In the extremities, they can analyze that. They're very good at measuring that. When it comes to the spine, we're the ones that are tasked with doing that.
Right.
And we do see that a lot, and it's not the fault of it's just a system in general.
The
It's not the
system.
fault of the doctors or anything like
Yeah.
that, but
I
you know,
agree.
in a hospital, they're trained to make sure, is this patient going to be admitted? Is it a neurosurgical type of case? You know, was it someone fell off a roof, they have potential fracture, or they have a acute spondylolisthesis, they need to see the
gotta
neurosurgeon,
handle
they
that
need
right
to be
away.
admitted.
Yeah.
If not, it's just prescribe some medication, now follow up with your doctor,
Right.
your primary care. Well, patient now is released, they have their medication. Will they follow up with their doctor? Maybe, maybe not. They have something to do. So, you know, education for the whole system is really great. Where I have a lot of, you know, ER doctors now that may say, follow up with Dr. Rodnick. And we're able to objectively diagnose the mechanical low back pain that they went in for. A huge percentage of patients that come to an ER go in for low back pain, whether it was just they woke up, bent over to pick something up, and felt a low back pain, whether it was a car accident, whether it was a sports injury, whether it was anything, but low back pain is a big reason people end up going to the emergency room.
Right. And I think also chiropractic care offers a quality of life that isn't necessarily addressed with physicians and medical doctors. And I think that that's part of the education that we need to put forth in every community nationwide. You know, I think that you know, part of the problem has been that your kind of care has not been accessible to veterans, let's say, to folks who really have to rely on, like, you know, Medicaid and so forth. And so they don't have the options that, you know, a person has who's in the workforce and who you know, has the additional resources at
carriers,
times.
yeah.
Exactly.
Yeah.
And so I think that, you know, as each community starts to address this crisis, we can start having this dialogue, and that's why I'm so thankful to be here today, because it really does start with this kind of a dialogue.
And a lot of it is, like you said, community education, but also, you know, the doctors, the chiropractors, the physical therapists have to also work on communicating with
Yes.
Each other.
interdisciplinary,
Yeah.
you know, because when I get out there and I have the relationships that I personally do in our community with all the medical specialists, with the primary cares, it makes it really easy to communicate about patients, make referrals for the best course of treatment and action for the patients to prevent the need for opioids and get to the root cause of the problem. Like you said, objectively diagnosing exactly what's causing it, how do we fix it, instead of just masking it and pushing them out the door, which is what, in general,
If you think about it, it doesn't claim to do anything else. It's there to cover it up.
It is.
And the
Exactly.
question should be like, what tissue? What's causing this? What's the problem here?
Right,
Yeah.
so it's treating the symptom, right?
Treating the
It's
symptom.
not really truly treating the cause
What
or the
happened from it,
problem. And
right.
quite frankly, who doesn't have back pain? I mean, you know, as I've gotten older, I mean, I go to my chiropractic doctor very consistently because of, you know, I've lived a full life and my body feels it some days, right? And so again, it's that alternative way of taking care of my body. And there's also, I feel like, a mental component as well that a lot of folks I don't think realize that also chiropractic care does include. I mean, you know, there isn't a time that I don't go into my, you know, chiropractic doctor's office and not learn something about how the brain is connected to a particular, you know, other part of my body, and how it all does come together. And I think if we, you know, as a nation and each community and state starts to realize that, you know, a holistic approach is a smart approach.
And working with everyone is the key. And I mean, I'm noticing the last 5-10 years, we're seeing that chiropractors have a key component and more of a seat at the table of the entire medical community, as far as doing comprehensive evaluations, getting objective diagnostics. Where I often will see a patient that comes in, oh, my shoulder's been killing me for a long time. And they've been on opioids for a long time, and they have a complete tear of the supraspinatus tendon. They need surgery. We're going to make sure they get to the right orthopedic doctor, get that taken care of. There's no amount of opioids that would help that. That's
Right.
torn off the bone. So we need to make sure that
fix it.
we need to fix the problem. And so whether it's a mechanical problem, misalignments in the spine that we can take care of and fix in our office, whether it's ligamentous instability, whether it's something torn, it's important for the doctor of chiropractic to also have rapport and relationships with all the medical professionals and be able to get to the root cause, whether it's something we fully treat and take care of in-house, or we help get fully treated and taken care of based on our referral network of everyone that can take care of it.
Right.
Get them to the right place of someone that can address that type of, I guess that'd be non-chiropractic problem too. Yeah.
Yeah, exactly. And what we're starting to see is in some states, they're really, obviously there's some lobbying involved and things like that, but to get some of those government programs like Medicaid to have more coverage for natural health care, for chiropractic, for physical therapy, for acupuncture, these type of things. And in the state of Michigan, the Medicaid policy does have coverage for chiropractic, but unfortunately in some states, they don't have any.
Yeah.
And not every chiropractor takes it, most don't, but we do in our office, and Dr. Lupo does as well. And as far as something like the VA now, we're just making strides to be credentialed and have chiropractors in the VA.
They just kind of started that. A lot of that stuff was new from, I think, last month.
Yeah, exactly.
I visited the VA this summer, and I was asking questions about, because what we talk about spine pain, and a lot of the people, they were saying that they end up sending them to Ohio, or they send them to Ann Arbor, because they're not really strong on that. And I think they're probably, they talked a lot about opioids too, and how they're really concerned about that.
Well, the good news is that we've made a lot of progress this last year with the opioid crisis. I mean, we have a president that actually is very aware of what's going on and really supports helping our country move towards a solution. So a bill was passed this last week. It's the HR 6 bill. It was a bipartisan bill that is really going to allow our country to address the opioid crisis in many ways. It's about, again, prevention, education, arming first responders with the necessary tools they need to help save lives when they're on the scene of someone who has just OD'd. And $6 billion has been allotted to help with this cause.
And this is a national program.
Right, so that's
Okay.
federally speaking, and now each state will, of course, receive their own portion of this money, and now it's really up to the state legislators to do the
How
right
they're
thing.
going to appropriate
Exactly,
the funds and where they're going to put it, whether it's public education, whether it's
Yes.
training for the doctors
Yes.
or whatnot.
And even raising the awareness, putting a campaign out there, and that's actively happening right now as we speak. And so, and there's been some very good measures taken as it relates to prescribing the number of pills that a patient leaves the office with.
And that
That's
was
been-
local Michigan law,
Yes,
right?
that's been
Okay.
greatly
Michigan.
reduced.
Do you know the numbers on that too? It was they can only prescribe what, a 7-day supply now, something like that.
Yep, exactly, as opposed to like 30. And I want to point out too, that, the folks that do need such drugs should be well taken care of. I mean, we don't want to take.
There's not a time and a place for it. Absolutely.
Exactly.
There's
I mean-
but it's for the right patient at the right
Exactly.
time at the right place.
Exactly, yes.
People that can't live without it, can't get out of bed. There's definitely certainly a time and a place for it. It's just become way too overused here.
Exactly, yeah. So, we've also been able to understand, relative to pharmacies and patients that perhaps visit different pharmacies to refill their prescriptions. We've closed the loop on that. So if, one pharmacy is visited and that patient tries to visit another pharmacy to get the same prescription filled, they no longer can do that.
And they can use the
Right,
MAP
communicate.
system as well to see if the patients have been taking the medication, right? 'Cause
Exactly.
Is that how some of
Yeah.
the problems started too, where they get a 30-day supply, that patient took it for 2 days, and now those drugs hit the street, right?
Yes,
Is that
yes, exactly.
they
Yeah,
had
yeah.
they just
Yeah.
really bad ankle sprain, got the prescription, took the pills for 3 days. Now they sat in a cupboard somewhere, and someone's teenage kid took them, and
Yes.
now they're in the high school.
Yes,
right?
exactly.
Or they
exactly.
sell them on the street and make money of them.
Yeah.
And then
Yeah.
they go back, and we're trying to get another prescription. Oh, it's still bothering me. And without the technology and using the MAPS type system to see if they're taking it, by looking at the toxicology, potentially that doctor could see they may still have a little ankle problem and re-prescribe, right? Is that sort
Yeah,
of
yep,
how
yep.
some of this started, right?
Yep. So
The patients then ask for it. They may still have some problem, but they're not taking it, and they're selling it, or they're
Right.
abusing
Exactly.
it.
Exactly. So, as a state, we are fortunate because we do have folks that are really working hard to make sure that we're appropriately putting new systems in place that are going to keep people safe. And it starts there. I feel that if, one less life is taken from us, we are in a good place. And I think
Absolutely.
again,
Less
it's
suffering too,
it's going to start with how many lives we start saving.
So we have a news clip we'd like to share with our audience here, just a little bit about what's going on here in Michigan.
New legislation signed today is aimed at fighting opioid addiction in Michigan. Lawmakers say the goal is to increase awareness by making it harder for addicts to doctor shop while requiring doctors to check a database before prescribing pills. 7 Action News reporter Kim Russell talked with the Lieutenant Governor about the positive impact he hopes this has on the epidemic.
Lieutenant Governor Brian Calley says that the addiction epidemic is now taking more lives in Michigan than car accidents, and something needs to be done. So today at this desk, he signed legislation. It is a deadly national emergency. In 2015, the American Society of Addiction Medicine says opioid addiction killed more than 33,000 people.
It's a crisis on our hands. This is an emergency. It needs to be treated like an emergency.
The question is, can legislation save lives? Democratic and Republican lawmakers stood together today in Lansing to say they are going to try. They were there as Lieutenant Governor Brian Calley signed legislation. A major part of the legislation will require prescribers check a patient's prescription history, which is now available in an online system provided by the state.
Whether or not to prescribe, that's still just the doctor's decision, but at least now they'll have all the information.
The package of bills would also require doctors have a bona fide physician-patient relationship when prescribing controlled substances. It would limit the supply of an opioid that could be prescribed for acute pain, work with schools to educate students about the risks of opioid addiction, and expand Michigan's Good Samaritan law to encourage people to report overdoses without fear of being arrested.
I've seen firsthand the way that it can just rob a person of potential. At the end of the day, what we want, fewer funerals and more second chances.
Lawmakers who took part in this legislation say this is just one step in an expected long battle against the opioid epidemic, and they're committed to fighting it. In Lansing, Kim Russell, 7 Action News.
And I think it's incredible that that they've been able to pass some laws and really hone down on the amount of prescriptions that there have been, the amount of deaths and everything, in order to inspire the lawmakers on both sides, you know, politically, to
Yes.
create these laws to help prevent, you know, the abuse and future deaths.
Yeah, I mean, it is good news that this is a bipartisan issue, right? Because we have the support of everyone, which is outstanding. Kim brings up a good point. It's, you know, this is a big battle, right? And so we're going to have to win, you know, in baby steps. But if we were to take a step back, I do think that a lot of the focus should be on the demand side. And what I mean by that is, you know, we can address the supply side. We can do that by, you know, making
Less
sure the drug,
prescriptions,
right,
less
exactly.
writing, yeah,
But the
all that.
demand side is the folks that have access to these drugs. And I believe that if we were to concentrate really on, you know, middle schools through high schools, I mean, that's where a lot of the kids experience their first, foray into taking such drugs. And so if we can really start, you know, visiting schools and again, educating not only the children but the parents. And that's hard to do because in so many households now, you know, you have 2 working parents, and it's hard to get their attention, believe it or not, you know, to have them attend, you know, a day where they can listen to the stats that are astounding, quite frankly, when you really look at them. But I think that, you know, if we really concentrate on, you know, getting to the children and educating them and letting them know that, like, it isn't cool to do this. It isn't cool to take these kind of drugs.
People
not.
die from this.
Yeah,
You know,
exactly.
it's
And, you know,
serious.
and again, like I mentioned earlier, you know, with sports injuries being one of the primary reasons why younger adults and kids, you know, get
You
hooked on
obviously
these
see
drugs.
a lot more sports injuries in
Exactly.
kids than adults. It's not
Yeah,
like you could
exactly.
adults out
Yeah.
playing soccer every day, you know.
Yeah. So again, you know, it is going to be in baby steps, but you know.
And what about for the you know, appropriation for the aftermath? People trying to get off opioids, programs and things like that. Like I've had a number of patients that have been on prescribed opioids for years for their chronic pain, and these are patients that it has helped them and has allowed them to function. And since starting our treatment, we've been able to help them, but getting off and kicking it has been very hard for them, where a lot of times they may have had to go to inpatient rehab type treatments, or even getting off the medication on anesthesia. I know that some hospitals now have programs that are
So that's an excellent
where they can get
point.
off
So
that way.
because the getting off these drugs is extremely painful for the individual. I mean, it is absolutely horrific in some instances, the withdrawal symptoms and so forth. And I think that is very misunderstood still. Again, I think that addiction is
Oh, just
still,
stop taking them, right?
Exactly.
Yeah,
And there's still, I think, a moral element to this. Like, I don't understand why you got hooked in the first place, and why
stop,
can't you
yeah.
just exactly? And so I think that again, the awareness and education of, you know, addiction as being a threefold illness, and it is truly one day at a time. I mean, it's really being able to successfully you know, put it down, put this prescription down, and what are you going to replace that with in a healthy manner? And that's going to take some, you know, mental facilitation. It's going to affect you physically, and there's also a spiritual element to it. It's like, you know, folks who are chronically addicted to these
It
drugs.
hurts to get off.
Exactly.
It literally hurts
Yes.
them. I mean,
Yes,
they're
it does. Yes,
pain
it does.
worse than they were
Yes, it
from the
does.
chronic pain.
Yeah.
And then oftentimes, when they're on them so long, they're in oftentimes more pain because they're on
Yes.
them. When they get off, they just feel better. I've seen a lot
Right.
of people that have been on for years and just feel better now that they're off.
Right. Well, we were talking about that earlier, Jeff, in terms of like the receptors. You know,
it alters your receptors.
Yeah.
So you feel pain differently, and it basically changes how you can sense things.
Yeah, it almost exacerbates actually. I think the pain that
Worsens
one
it,
is
yeah.
in. Yeah, exactly.
So that your pain that would feel this much,
Yeah.
after you go through this and change your receptors, the same amount of pain, you experience a difference.
And for a lot of these patients, when the chronic pain patients, it becomes just a part of their life. They have their prescription, their day revolves around
Yes,
what doctor's appointments am I going to have today, what doctor am I going to see for this, and it just becomes almost to the point subconsciously they almost don't want to get better.
It's like a lifestyle.
It's a lifestyle.
Yeah.
If they weren't in that, their whole life would be changed if they
Exactly,
didn't. They
yes.
got to go see the chiropractor this day, they got to see the pain doctor that day, they got to do this, and
their whole
their
quality
whole
of life
life
becomes
revolves
affected.
around this. Exactly.
Not to mention their personal relationships. I mean, that's another huge component in this. I mean, you know, yes, people die from it, but the people in some cases that don't die from it, their whole personality changes. So truly, you're not, you know, your loved ones are different. They're acting different, they're thinking different, and so with the passing of this bill this last week, I think that there is a ton of resources that are going to go into treatment centers and so forth. But I also, you know, I think that the centers, the recovery centers need to be accountable. I feel that moving forward, we have to have new metrics that prove that it's working, that the treatment of recovery is actually working. You know, what are the rates when someone goes through a treatment facility after 30, 60, 90 days or even a year? What are the, you know, what are the numbers showing? How long are they staying healthy and clean living, you know, upon completing such a program? And I think that we can start to look at new metrics again. Why not? I mean, it's taken us a long time to get here, and a lot of it hasn't worked. So, you know, it's okay to start looking at new ways to define success.
And what's difficult, even like you said, metrics for that, like, you know, would the patients who go there be required to have a urinalysis 3, 6, 9 months, right? But the thing is, these are legal products. It's not like they're a criminal and they have to be tested to see if they're breaking something. So that's where it's a catch-22, because this is not like they're doing something wrong even when they were taking them. Even if they're
following
properly
doctor's
prescribed,
orders.
they're following doctor's orders. So then are they required to, after the fact, follow up, be tested, you know?
Right.
And if they don't want to, can they not be required to do that?
Right.
You know, the
And
patients
again,
themselves.
you know, helping the individual who's in desperate need to get off these drugs is extremely important. But again, we still need to focus on the
big
younger
picture,
adults
yeah.
who haven't gotten hooked yet, the kids who haven't gotten hooked yet, because those are the lives that we need to pay attention to. Because statistically speaking, it is very dismal in terms of looking at folks who have an opioid addiction, who have, you know, OD'd, who are in treatment. Only 2 to 20% of folks are able to stay sober.
Wow.
Wow. Let's
Okay.
focus on that again for a minute as we're finishing.
Yeah.
2 to 20% of people that got off of the prescription or off of their addiction
Who are,
stay sober from it.
that's right, that's
Wow.
right. And my stepson was one of those stats. He had been in treatment, and, you know, he OD'd. So looking at those stats, that's why I feel like the focus is absolutely on prevention.
Don't get on them in the first place.
That's right. That's right.
An alternative.
That's right.
Think of something.
Well, thank you guys both for joining us. That's all the time we have today. Again, this has been Ask the Chiropractor. We hope we've shared some really great information about what's going on in Michigan and in the country right now. Stay healthy, Oakland County. We'll see you next time.